I'm Dennis Anderson along with Julie Zenner, and here's what's coming up on Almanac North.
The St. Louis County Board passed a record-setting budget for 2020. We'll break it down with two county board members.
A $1 million federal grant will help Essentia Health and other partners fight opioid and other substance abuse in rural areas.
And we'll have the week's top business headlines from the editors at Business North.
It's all coming your way next on Almanac North. Hello and welcome once again to Almanac North. Thank you very much for watching. And Julie, this is going to be our final show of the year since we are going to be off next week for Christmas.
Nice to have a little break to spend some time with family and friends. I hope you get a chance to do that, and folks out there do as well.
I'm sure they will. Yes, we certainly will too. So, all right, your turn.
All right. Thank you, Denny, and welcome everyone. St. Louis County is the largest county east of the Mississippi River, covering about 7,000 square miles. That's actually larger than 3 U.S. states. Within that large geographic area, the county serves about 200,000 residents with some 1,800 employees. This week, the county board approved the 2020 budget, and tonight we will break down that budget with some board members. Patrick Boyle is the current board chair and represents the county's 2nd district. And Beth Olson is chair of the County Finance Committee and represents the 3rd district. And thanks to both of you for being here. Really appreciate you coming in. Commissioner Boyle, before we get into the budget, it's been a real snowy start to the winter, and I think a lot of people are kind of watching the situation and the prospect where plow drivers in the county could be going on strike. I know you can't get into negotiations on the air, but can you give us any sort of an update on where that is and the urgency of getting things settled?
I think one of the first things is, we as a county board really respect the negotiations that go on between our public employees and administration. That being said, we are hopeful that there will be a very good outcome out of this. It's still in negotiations. We really respect our employees, the men and women that are with the Teamsters. They're out first thing on the roads. As you say, we have 3,000 miles of roads, 600 bridges. We want to make sure that we get kids out safely on the school buses and get people to and from work in an efficient and proper way.
Sure. All right, let's get to the budget. It's a record budget this year. Where is the big increase? Where is some spending increasing that perhaps wasn't there before?
Yeah, thanks, Denny. I think the biggest increase that we have is our investment in our public works department and the equipment that's there. So we are adding $2 million to our budget to invest in equipment that's well needed. Mm-hmm. We have the ability to provide tandem trucks, which can do a whole lot of things that they didn't used to be able to do. We used to have separate trucks for every thing that we needed to do on the road, and now we can buy trucks that we can pull parts off and put parts on, and those last a lot longer, and they're more sustainable, and we can use them for more things. Sure. And so we're getting rid of the old equipment, and we're bringing in new and better and more efficient equipment.
Is social services still up there at the top?
Yes, absolutely. We did have to, we invested in a few more employees in social services, some support specialists for our social workers to, just help them as they're meeting the needs of people. But we have seen a steadying of our out-of-home placement. So as you remember from previous years, that's been on the rise, and now we're seeing it level off. So we're seeing our response is matching with the need. And so we're catching up. We're doing well.
We have more social workers on the field with the boots on the ground, and that's so very important to help those families that are struggling.
We do have a graphic up on the air, and maybe you can take a look at it and walk people through who might not be familiar with how the county money is spent. What are those big chunks? You talked a little bit about Health and Human Services, but where does the other money go?
Health and Human Services is one of the big three. The next is law enforcement, the judicial court systems, law enforcement is the next biggest one. And the third would be Public Works, what we just talked about, the highway and the bridge system, and making sure those are cleared.
What will this mean for the average homeowner?
Well, it depends on where you live, of course, but it adds anywhere from about $20 to $30 a year, somewhere up in 40, depends on where you live because we have a complex tax system, but about that much a year.
Percentage-wise, what, 3-4% increase?
The percentage increase for homeowners would be about 3.5. Yeah.
With the property growth we had this year at 3.5%, it takes a lot of that chunk off, so people won't feel it as well. And we're in uncharted waters of almost 10 years of property growth.
Where's that growth coming from? Is that new people moving in? Is it the county selling some of its land? New businesses? What is it? What's driving it?
You named a lot of it right there. As we're selling some of our leased lands off. Potlatch is getting rid of a lot of their land. We're seeing some growth, especially in the Hermantown area and City of Duluth, and some on the range. I think it's all the above.
Some of your lands were devalued a little bit. I understand Congressman Stauber is now going to work to increase the value again. Tell us about that.
That just came out today, and Senator Tina Smith and our U.S. Rep Stauber have been carrying a heavy load on that. It was about land, especially in the boundary waters, that we feel is devalued. When they took it off the county roll, they then give us supplement money that we lost. So it directly affects St. Louis, Lake, and Cook County.
Would you say that the overall health of the county is pretty strong right now, economically and in terms of where the county's positioned?
I definitely would say that. We have, with the economic growth that we've had, we've been able to make really targeted investments in health and human services, in public works, and we're making a lot of progress on our roads and maintaining them, and a lot of progress in meeting the needs.
Which brings up the county transportation tax. How is that doing? Is it bringing in enough revenues now to increase maintenance on roads and bridges?
It definitely is. It's bringing in it was over $15 million this last year that it brought in, and we've seen the number go up kind of steadily over the last few years, and we're not sure, we haven't had it long enough to see where it's going to level out. But of course the brilliance of that tax is that we share it with everyone who comes into the county, and so it's not only on our own taxpayers.
Will there be more road work done this coming summer?
Yes, there will be another $60 million in projects.
What are the big infrastructure projects that people can look ahead to?
At least in my own district, we will finish up the Woodland Avenue, which was significant. We started this year. We'll continue into 2020. Other than that, I think there's some projects up north. We got some bridges that need to be replaced. We have about a 20-year path of projects, depending on how the road conditions are, bridge conditions are, of continuing to move that money forward.
There's talk of a new fire hall for Virginia, Mountain Iron. Will the county be involved in funding that, and how far along are we?
Not regarding that. No, I don't think we have any partnership on that.
No partnership on that whatsoever.
We did build the Cook Public Works building, and we also did the Virginia Health and Human Services.
The Cook building is open now, is it not?
They both are. And I'd like to say also that Health and Human Service building in Virginia is one of the greenest buildings, public buildings in Minnesota, if not the Midwest. We're almost running at 0% with our geothermal and then with our solar panels, so it's something to be very proud of.
We've made a lot of investments in making sure that every new building and every time we redo a building that we make it sustainable in terms of energy, so we're reducing the costs, and then we're seeing those effects immediately, and of course long term they'll have a huge impact in our budget.
We have some folks coming on in the next segment talking about battling the opioid crisis in rural areas. What's the county doing on that front, and how are they helping with that issue?
You want to take this? Yeah.
I mean, it's a little two fronts. We continue to do the three legs to the stool is enforcement. we continue to partner with grants, making it easier for our enforcements to talk to each other quicker, easier. So sometimes we get the person selling, but then we can get the dealer on top of that quicker at a state and a federal level. Was part of it. Again, prevention is so significant. Encourage funding into that, and then the treatment side. So when someone overdoses, that we can get them back to health, get them into the system, into treatment right away. There's no cracks in services, and we're starting to see, as Beth said, results of that with out-of-home placement. We're not seeing kids getting taken out of the homes as far as we once were.
Beth, talk to us about the county's credit rating and why is that important?
Well, we have a AA+ bond rating, and the reason why that's important is it gives us great interest rates when we're bonding for projects. And so we have a process where we make sure that we keep our debt service, which is the amount we're paying back to bonds, that we keep that only 5% of our entire budget. And so getting those interest rates allows us to invest more, and then allows us to stream that out, so we're not impacting our taxpayers.
Speaking of bonding, what do you want to see from the state this year in 2020?
We have a huge list of projects, as you know. So we have the depot, the St. Louis County Heritage and Arts Center depot, that we need some infrastructure done there. We have a project for the St. Louis County Fair to restore some of the animal barns up in the northern part of the county. We have a mental health crisis center, completing that project. We need some money for that. So we have a number of things with the county that we want all of them, of course.
A very good news story is 2 years ago, one of our top priorities was the mental health initiative bonding money. And so far, St. Louis County and Arrowhead regions gathered just over $10 million. One for 30+ units for placement for those dealing with mental health, for housing. And number 2 for a crisis center for those to help keep folks not having to use the emergency room system, but then get them the help they need. So that's a big win, over $10 million coming to the area.
All right, well, Commissioner Boyle, Commissioner Olson, thank you for coming in and sharing some insights into what's always a complicated subject, the budget, but I think you clarified some things tonight. Thank you.
We appreciate it.
Thank you very much. Thank you. A federal grant to fight opioid and substance abuse has been awarded to Essentia Health and other partners. The grant will help target substance abuse in rural areas and give access to timely treatment for patients with opioid use disorder. Funding will be dispersed over 3 years, making recovery programs more available in rural and tribal communities. Now, here to tell us more is Pat Conway, the project director at the Essentia Institute of Rural Health. Diane Holliday-Welsh is Operations Administrator for Behavioral Health at Essentia, and Heidi Favett is a Community Health Worker at Essentia Health's Ely Clinic. Thank you all for being here tonight. And Pat, you received a grant last year to develop a strategy to fight opioid abuse. Now, this money is now being put into action. Tell us about that.
So we're really excited that we received the one-year planning grant across the Essentia Health region, and teaming is really the answer to the problem, I think. So we have a team that wrote grants, a team that came up with the idea, a team across the region, and then here in the East, which I think we're well represented here to explain, is a team within Essentia Health and across the communities in St. Louis County.
So just how big is the opioid crisis?
it's a challenge on so many fronts. There are the issues about prescribing opioids, people who may have used opioids appropriately for many years, and changes in prescribing. There are issues within families when one person has a prescription and someone else actually uses the opioid. And then there are the street access to opioids that create challenges, especially I think we've been working with Dr. Flurkey's court also and some issues between the jail and the community, and it's challenging.
Diane, Pat mentioned that this is a real team effort throughout the region. What are some of the strategies that the team will be working on with this money to really make an impact in ways that haven't been done before?
So as you think about the role of a health system, is really to provide the medical care and make sure that the patient is medically, or from a health status perspective, is stabilized. But we've seen in some of our other care delivery models that we need to surround that patient with the resources that they need to be successful beyond the walls of our clinics or beyond the walls of our hospitals. And so to really build out that team, we need to have community connections. So in some cases, transportation to appointments, making sure that that patient can get access to the medications that they may need. So really designing a care model and a system of care that supports the patient beyond the health system. So care navigation has been significant as it relates to supporting that patient that needs almost like a coach beyond their medical care, and making sure that they have the resources that they need to be successful. And then working with that family unit. You know, it's oftentimes there's more than one individual involved, and so how do we support that family in their care as well?
Heidi, currently is it more difficult to get treatment in rural areas, rural parts of St. Louis County, and in tribal areas too?
So absolutely. Much of the treatment that people need is outpatient treatment, and for example, from our community in Ely, it's 50 miles to the nearest outpatient treatment program, and people tend to need to go 3 to 5 days a week for an 8-hour day to treatment. And so that's a really big endeavor, especially many people have lost their license as part of their addiction, and so trying to find that balance for how do we get people to treatment. Having treatment so right in your own community makes that more feasible. For people who are going inpatient, we're often seeing people going as far as 5 to 8 hours from their home to do those inpatient treatment programs.
But this should change then with the grant, is that correct?
So at this time, our grant is really focused on how do we connect people to services. And so it's a development grant. It's not about actually building anything new, but it's about connecting those services to each other and taking advantage of what we already have. So for example, in the Ely area, we really connect all our service providers to each other, and then we provide a role, that care navigation that Diane mentioned, the community health worker role, so that people have an easy way. They don't have to do all the work themselves to get connected to those services.
And this program in our area is going to specifically focus on Ely and Virginia, I understand. Why were those communities chosen?
They already had the advantage of the very successful program in Ely that had the component of the community care team and connections inside the community. They have a very strong community network there. The next step made sense to move to Virginia, who has an interest in participating physicians who are prepared to provide treatment, and community organizations such as Range Mental Health Center who provide community support, and then we could then easily connect to resources in Duluth. So for instance, the Center for Addiction and for Alcohol and Drug Treatment is going to provide consultation with Ely and Virginia around the issues. That's one of the ways to resolve that issue about the access to care in rural communities.
So once this grant has been spent, will there be a need for additional monies, additional revenues to be raised, and how would you do that?
That's a great question. So sustainability is an expectation from the funder from the beginning, that we have to start immediately right now. We have to have a plan now for sustainability 3 years from now. So in 3 years we'll come back and tell you what that plan is. How's that? But we are working on that, and we were just talking tonight about how are we going to fund the behavioral health specialist in Virginia. We're paying for the care coordination out of the grant. How do we find funding for the behavioral health specialist, which is Diane's shop, for the person in Virginia, and then who do we get engaged in the community might already have some resources that they can tie into this grant.
Sure.
So that's a great question.
And are any answers coming together?
I mean, there are some, maybe not answers, but some at least thoughts towards the solutions. And you know, this is also, with this grant, is giving us an opportunity to leverage telemedicine services. Sure. So when you look at sustainability, oftentimes it's making sure you have the resource, but you may not be able to support that full resource in a community or in a location. So we are, as part of this process, adding telepsychiatry and teletoxicology to the Virginia campus to support patients that may need that level of service. So some of these solutions might come from technology, others, you know, as we look at different funding sources. And you know, this is a growing problem. It's impacting all of our communities, and so in time, I think we will see additional resources available to reimburse for the care that we're identifying. We'll have more documentation and the outcomes that we've achieved that helps support that reimbursement structure.
Heidi, it sounds like the reason that Ely was chosen was because there are some really good things happening there. Do you see the programs and the partnerships, that model being something that can be replicated in other communities and maybe help other parts of the state deal more effectively with the opioid issues?
Absolutely. So the Ely Community Care Team has been functioning since 2011, and we have the clinic and the local hospital, which aren't affiliated with each other, and the schools. St. Louis County Public Health and Human Services are a really important partner in this. All our local nonprofits and community members all meet on a monthly basis and look at how do we knit our services together to best help make sure people aren't slipping through the cracks, and then how do we make sure people get from service to service, and we're all looking at the whole person, not just what they came to me for today. And so we've been doing that really successfully for a long time, and so we're ready to roll that model out, help communities not have to start from the beginning, but to learn from what we've done. And so it's very replicable, and it's a matter of just finding those groups that are ready to start and have the energy to launch that in Virginia. And so we're really excited to capitalize on that.
We've only got about 30 seconds left. Are physicians and nurses being trained in fighting opioid and other drug addictions?
They are. You know, there's many of our physicians that, when you look at a patient that needs to transition from an opioid, it's called a wavered. They become wavered, which means that they can prescribe Suboxone, which is at least one measure to help a patient wean themselves from an opioid use.
I see, yeah.
And so that is becoming more standard. You know, I don't know the exact number within Essentia, but if we were to compare it to even a year ago, it's a significant number that have become wavered.
Well, Pat, Diane, Heidi, all the best. Hope it works well for you. Thank you much for being here tonight.
Thank you. It's time now for the business news from Business North. Twin Metals Minnesota on Wednesday submitted a formal plan to state and federal regulators for its proposed non-ferrous minerals mine. The company hopes to extract copper, nickel, and precious metals in an underground mine. The project is highly controversial because of its close proximity to the Boundary Waters Canoe Area Wilderness. Supporters say the project would support 765 jobs. Opponents fear it would produce toxic acid runoff. It could take years before environmental studies are conducted and reviewed by regulators from several different agencies.
Two Bayfield County Peninsula companies have received achievement awards for contributing significantly to the well-being of Lake Superior and its residents. The recipients are Madeline Island Ferry Line and Apostle Island Cruises. Both were recognized by Lake Superior Magazine for their community service. They were deemed integral parts of their communities by the publication. Lake Superior Magazine has given out the annual Achievement Awards to individuals and organizations since 1994.
The College of St. Scholastica has received grants that will enhance experiences for its nursing students. The School of Nursing was awarded a $2.79 million federal grant so nurse practitioners can work with the nurse practitioner students in clinical settings. The program will enhance mentorship skills for veteran nurse practitioners while students gain primary care experiences in underserved communities. Scholastica also has received more than $1 million from the Manitou Fund of St. Paul. It will pay for renovations to the nursing department classrooms, creating state-of-the-art hands-on educational experiences for students. For more on these and other stories, visit businessnorth.com.
You can keep up with our latest topics and interviews and earlier stories by following Almanac North on our social media channels. You'll find us on Facebook, YouTube, and Twitter. And for updates about your favorite PBS programs, visit the WDSE website, where you will also find news about the station and learn about our upcoming public events. And Julie, this is our last show until the new year. 2019 is almost over.
It is just crazy how fast the years go.
I don't know.
The older we get, the faster they go.
The older you get, the faster it goes.
That's right. You never age.
Oh, what are you going to do? For Julie and the crew at Almanac North, I'm Dennis Anderson. Have a Merry Christmas and a Happy New Year. And good night, everybody, and be kind.